Madam, we are live.
Okay. So welcome everyone to this new session on gut dysbiosis and the relationship this has to endometriosis. And a lot has been said about leaky gut and how the digestive cascade, if it is improper, how it can actually affect the gut health, which in turn causes inflammation. And there is a link between poor gut health and endometriosis. And Jay today is going to tell us about the impact of gut health also on the local estrogen production and leaky gut, and hopefully answer our questions as to practically how can we apply this information and how we can sort of guide our patients forward so that the recurrence rate of endometriosis hopefully will be lesser if they take care of their gut health. So gut Jay is very good at connecting the dots between theory and practice, and we're looking forward to hearing from you, Jay.
Okay. So hi guys. See, this is going to be a little boring topic, and I'm not going to be speaking for more than 5 to 7 minutes. I can already see some people putting their tongue out from their mouth because these types of topics are currently under a lot of research. But we must remember one thing. Evidence is pointing towards the fact that definitely there is something wrong as far as the gut pelvic axis is concerned, and it is the mistake in the gut pelvic axis which I'm going to correlate clinically when we try to understand a lot of clinical stuff which we end up doing as far as endometriosis is concerned. All right. So in our previous master classes, we have already studied the fact that endometriosis is going to be predominantly a disease where there is going to be excessive estrogen. And how does the gut play a role here? Okay, so I will just go to the live video sharing. You can see me, ma'am. You can see
Yes.
the screen.
Yes.
Right. So I have actually drawn the endometriotic nodule to explain it to some patient today. So I'll just draw something else. So you all know that we have the bladder, and behind that is the vagina and the uterus, and then there is the bowel. And when we typically try to draw endometriosis, we would want to draw endometriosis here, that is deep endometriosis. Simultaneously, I would also like to draw the small intestine. And when you draw and understand the small intestine, now most of the times when we draw the small intestine, we are drawing it with the intention of cutting it. Okay, but today I'm going to explain something different. Above all this, you have the beautiful liver, and in the liver you have the gallbladder, and gallbladder releases something inside the intestine, and that something is called as the bile. Correct? We know this. Now, the intestine is actually lined by billions of bacteria. Billions is the word. Okay, now these are your nascent gut bacteria. All right, now what typically happens is this bile, okay, it has a very high concentration of estrogen. Okay, and typically it gets excreted out from the gut. That is how the estrogen is metabolized. We try to talk of something called as first pass metabolism, right? And this first pass metabolism converts the estrogen which is in the blood into its metabolites, active metabolites, and then some of them gets excreted into bile. Okay, now there is a crystal clear understanding that there is something called as the gut pelvic axis. Okay, now this gut pelvic axis, just like how we have the HPO axis, there is some axis called as the gut pelvic axis. And sometimes, as Aarti madam mentioned, there is something called as a leaky gut. That means some of the intestine is little poor, and there is some amount of damage which allows a part of the bacterial LPS, that is called as lipopolysaccharides, which are present on the cell of the bacteria. So if I just draw a bacteria like an E. coli, which is a rod-shaped bacteria, its cell wall is going to contain some lipopolysaccharides, and these lipopolysaccharides will leak out inside the peritoneum. So obviously, based on the peritoneal fluid circulation, one of the places which they love is to come and settle down in the pouch of Douglas. And this pouch of Douglas is predominantly the depth of the pelvis. Now, whenever this happens, it incites a abnormal inflammatory reaction. This abnormal inflammation in combination with abnormal estrogen okay, gives rise to predominantly the formation of endometriosis. And apart from giving rise, very important, if some endometriotic cells are present, this is something which allows the endometriosis to be sustained. And as a result of this, this gut pelvic axis is extremely, extremely important, right? And as a result of this, what typically happens is when there is a leaky gut, no, the bacterial concentration goes down. So bacteria produces something called as short chain fatty acids. This we have studied in our biochemistry. That production goes down, and the estrogen which was going to be excreted out from the bile gets reconverted back, and it re-enters the circulation. So this estrogen gets reconverted and it gets re-entered the circulation, and it adds to endometriosis. Now this is theory. So how does this help us? You know, many times we give an antibiotic which we don't really like, or sometimes even if we like, but it may or may not be a part of the standard protocol unless we open the bowel. Remember, whenever we open the bowel, the first thing our anesthetist, or I mean, we are going to tell our anesthetist in a situation like this, ek kaam kar, ek metrogil de de, right? This metronidazole is given predominantly to make sure that whatever, when the intestine is opened inside the peritoneum, whatever leakage of bacteria has occurred, metronidazole takes care of that. And there is a wonderful concept and study coming along. It is yet to be validated, but early papers have already come in to support the gut pelvic axis, which says that after you finish radical excision of endometriosis, just like how you spray normal saline in the peritoneum, in the pelvis, and then give a wash, you should give a wash with metronidazole. And a metronidazole wash at the end of the surgery may reduce the rate of recurrence in endometriosis. This is being studied very extensively. And I just thought I should mention about this because it is purely based on the gut pelvic axis. The other thing, which is a very hit thing clinically, is endometriosis diet. If you ever Google on endometriosis diet, or if you ever log into Insta, then apart from wonderful Shilpa Madam reels, you will also see something which is endometriosis diet. And that really pops up because people love it. People absolutely love it. Okay. And one of the things which is categorically mentioned in an endometriosis diet is giving the patient a high fiber diet. Correct. The advantage of a high fiber diet is the fiber itself binds to this estrogen which is released from the bile and allows the estrogen to be excreted from the body. Along with this, giving probiotics may be a big benefit because giving probiotics to these women help in replenish the bacteria in the gut. And once the bacteria in the gut is replenished, the production of short chain fatty acids, which I was mentioning, would go up drastically, thereby preventing the recurrence of endometriosis once it has been completely operated, right? So considering all these things in mind, you know, people published and people experimented in mice, and those papers have come out very recently in 2024, yet to find human applications, but I think it is just 1 year to go because a study like this has already been sanctioned at 2 different locations in the world. That is to take the bacteria from the feces of a normal patient who is not having endometriosis. Of course, fecal culture is so common, so you can grow these bacteria and transplant these bacteria endoscopically into the intestine of somebody who has endometriosis. And they've already proven it in mice. So they are trying to extrapolate it to humans that after you do a complete surgery and you also do something called as fecal microbial transplant endoscopically, you may drastically cut down the recurrence rate of endometriosis in these women. Okay. And that is a huge postulation. It is coming inside in a massive manner. Okay. As far as endometriosis is concerned. And that's the reason why I thought studying the gut pelvic axis for endometriosis and dysbiosis is extremely important for people who are trying to give probiotics to the patients, for the people who are trying to tell people that, okay, you know, why don't we try an experiment with an endometriosis diet? Endometriosis diet is nothing else but high fiber diet with some good amount of carbohydrates and oils, because you want the oil to go inside and bind to that estrogen, thereby allowing the estrogen to seep out inside the pelvis. But remember one thing, there have been multiple studies, and all these multiple studies so far have given rise to one conclusion, that at this moment we can't really prove that the diet is going to reduce the disease spread in endometriosis. At this moment, we can't really prove that giving probiotics is going to benefit endometriosis, but it has been proven without doubt that after you do a complete surgery, all these things can be a great adjunct as far as your disease is concerned. You should not be giving these drugs like probiotics, metronidazole, whatever, when you are giving patient medical management. Let's say the patient is on elagolix and dynogest, all this is shit. It has got no role because the disease is already inside the body and nothing like this is going to work. But once the disease clearance has been done, giving an endometriosis diet or giving metronidazole or giving probiotics are definitely good as adjuncts. Okay. And the recommendation for giving them as adjuncts is pretty high. Okay. So with this, I conclude 8 minutes of my talking, and I'll be happy to answer questions. Though I know that this is a very radically different topic. Somebody was laughing on me that or people को dysbiosis का spelling भी नहीं पता होगा. But you know what happens is when you are trying to do a masterclass of around 50, 60 classes, understanding these basics is important because every class from here onwards, from Monday onwards, we are going to be smashing all these basics to prove the theories as right and wrong, which will probably help you in clinical practice.
Yeah. So, I mean, couple of things when you talk about dysbiosis and gut health. I mean, there are people who are doing only like, so much about the gut health on the social media, and it becomes like, so important for various things, like talk about like skin, talk about your mental well-being. For everything, gut health is, I think, the thing now, because whatever you eat, I mean, it plays a very important role on how the disease, like either prevention or the disease progression or whatever. So since like, we are living in the era where we have so much to talk about gut health from all aspects. So there are a couple of things that come to my mind. So when people ask, like, we see a lot of these adolescents who come with endometriosis, who have like 6 centimeter, 8 centimeter cysts, and they say that, is there anything that we can actually eat or not eat, or any supplements that can prevent us from either progression of the disease, or can we avoid a surgery?
Yeah, I actually want to mention two things here. In India, we have something which is beautiful, and that is nutraceuticals. Okay. And that is only available in India, which is marketed as a pharmaceutical product. If you go abroad, it is available like a chewing gum, over the counter. I mean, the value of a nutraceutical is as good as a chewing gum. Understanding?
Correct.
But in India, it is marketed that, oh, you take this nutraceutical and whatever. So remember one thing. People love to change what they can actually change, right? Food is something which you can change, isn't it? And when you can change the food, people really want to experiment with that food. So the answer to your question is, you can give them a possible diet which is including high fibers and anti-inflammatory foods. And anti-inflammatory foods, again, which has been proven uh, out of context, is turmeric, which is normally called as haldi, which you can drink is with water, milk, whatever. I want people to be careful about a nutraceutical product which is available as resveratrol, which people may promote to you as an endometriosis tablet, that you give this as a antioxidative endometriosis tablet. That is absolutely crap. Okay, when you try to talk of that, so be careful. It's better to waste your money on elagolix rather than wasting your money on resveratrol, is what I think. When you try to work out how out of the two which is more horrible, then definitely resveratrol is more horrible. Elagolix is little less horrible as compared to that, right? So that is one thing. The second thing which you probably mentioned, and a lot of people across the social media platforms talk about this, is that I want to avoid eating red meat, right? Now, how much red meat do people actually consume in a country like India, where people predominantly consume chicken and fish? The percentage amount of red meat in your diet is extremely less. Okay. And because that is extremely less, by implementing such policies that, okay, from tomorrow morning, I will not eat red meat, it makes no difference, right? For an Indian situation, it probably makes difference for probably a Chinese, Japanese, American situation where meat is the predominant diet, right? It may not help in an Indian context or in an Indian scenario.
So you talk about all this. I mean, what about the milk and milk products where the dairy,
Yeah,
it
yeah.
is such a
Sorry,
billion
sorry.
dollar
I was coming to
business.
that. Yeah, sorry,
Yes,
sorry,
it's
ma'am.
a billion-dollar business in India, and so much of our problems, especially the estrogen-dependent diseases, are
Yeah.
related to these milk products, I
So a
suppose.
lot of people have spoken about this, and I think there is some good research about this as far as the proportion of A2 milk. That means a
Yeah,
separate type of, a
yeah,
separate breed of cows who are available. Supposedly, they give rise to something called as A2 milk, which has extremely limited amount of, unhealthy fatty acids which are present inside this milk. Does consumption of A2 milk, and that's a very big business. A2 milk, as far as organic industry of India is concerned, people really want to promote and give you organic A2 milk, extremely pure, in 15 minutes at your doorsteps, okay, at 7 times the price of the normal milk. But you must try and understand this. Just drinking A2 milk enough is not going to cure you of endometriosis. As I told, all of them are adjuncts. Once you have got treated of the disease, if you are looking at preventing the recurrence of the disease, and trying to adopt something which may reduce the chances of the disease and the microscopic focus of the disease coming back, that is when you look at all these things as an option. Not when you have a 27 centimeter endometriotic cyst and you are waiting to die, so you are wondering, do you drink A2 milk and die, or do you drink a normal milk and die? Right, that should
exactly.
not
Exactly.
be the take home point.
Yeah, yeah. So there are a lot of people who are actually, in so much severe pain, and they want to make some dietary changes, lifestyle changes, and try to cure their endometriosis.
Yeah.
So as you told, so probably in preventing the recurrence, probably in, like, after a very good surgery, these will really help in kind of the prevention of recurrence, or symptom may get a little better than what it was, but it is not a substitute, or not a substitute for either the medical management nor the surgical management per se. But definitely all estrogen dependent diseases like polycystic ovaries, fibroids, or endometrial hyperplasia, similar to that, like endometriosis, definitely the diet and the gut health plays a very important role, like in any other disease probably. And I think we all, as consultants, can, as Dr. Jay said about high fiber diet and such things, can help in just being an additional thing, like an adjunct, and not really as a replacement. So thank you very much. Any more questions on this very different topic will be answered on WhatsApp by him, because I think he is an expert in gut health. I know, I mean, he eats really healthy food. So good night, everyone. Thank you
If
very
I
much.
have a few comments.
I'm sorry. I'm sorry.
Yes,
Yeah, yeah.
yes,
Sorry. Yeah.
just a few comments. Thanks to this topic, I sort of read up a little bit more about this gut health in endometriosis. I just had a few comments. One is dysbiosis refers to microbial imbalance in the body. That is, a healthy microbiome actually contains 1,000 plus diverse bacterial species. So dysbiosis is when this diversity is reduced. That is something which I came across, which was interesting, which defines what is dysbiosis. And when you give unnecessary antibiotics, the diversity of the bacteria in the gut actually reduced from 1,000 plus to less than 200. So this was something which was very interesting to note. And Jay, another thing I came across was when you mentioned, like, there's a leaky gut and all these endotoxins are leaking out and they're going and settling in the pelvis. The reason why these endotoxins go and settle in the pelvis, the body chooses to put these endotoxins in the pelvis, is because the pelvis is far away from the vital organs like the heart, brain, and lungs. And that's the reason why all these endotoxins actually go and settle there. So that was another interesting thing I looked into. And I had a question whether you notice more of this dysbiosis in bowel endometriosis, Jay.
No idea, ma'am. Honestly,
Because
I
there
have
are
no idea.
papers saying that you see more of dysbiosis in patients who have bowel endometriosis, and also somebody who has had gallbladder surgery also in the past, because there is continuous
No,
dripping of
no, gallbladder. That's a gallbladder surgery is a known thing because it reduces, the washout of estrogen from the body. once the gallbladder is removed, so the bile concentration gets reduced drastically, right? And
Right.
as a result of this, that is a known thing. But then I don't know if it is more commonly seen with bowel endometriosis. I have no experience of that.
Right. And what you just mentioned, you and Shilpa, about the endometriosis diet, basically the diet is trying to improve the biodiversity of the gut bacteria.
Yeah, absolutely.
Right. And so everyone should know what are the inflammatory foods and what are the
Anti-inflammatory ones.
anti-inflammatory foods. Yeah. So that's just a few things I wanted to add, Jay. Anything else? And one more thing I came across, interesting thing, was something called as the FODMAP diet for endometriosis.
I don't know, ma'am.
So
But it
nothing,
sounds,
it's the same. Yeah, it
it
sounds
sounds very cute.
Yeah, he should eat it.
very
Yeah. Okay.
yeah.